We're live.
We're live.
Coming to you live from the living room.
Hey, y'all. What's up? This is OnyxRose.
An egg.
This is Egg. This is part of the podcast series OnyxRose, A Journey Through FFS. You can find me on OnyxRose9.substack.com and eggysalad.substack.com. So today or tonight, this evening, we are going to talk about post-operative care. You know, yesterday was the pre-op, and I was admittedly and uncontrollably unsure of what was going on. We talked with the surgeon. My parents were there. Egg was there. Everybody, I think, had calmed down by the end of the discussion. Late last evening, I received an email. Please show it a little bit better.
Lots of
documentation of post-operative care.
And a little bit of preoperative.
And a little bit of, yes, a little bit of preoperative.
Yeah.
So, you know what? I didn't even turn my microphone on.
You know what? I didn't either.
Let me turn my microphone on. Maybe people can't hear me.
Hey, what's up?
Okay, hey. I don't know if y'all heard any of that.
I'm sure they did.
Do you think?
Yeah.
Okay, how's that?
It's just the audio is going to sound better now.
Okay. So we got the clear audio now. Anyway, this is OnyxRose and Egg. So Egg, why don't you read for us the preoperative care or the preoperative steps that we need to take, or I need to take? I'm sorry.
So there are 4 preoperative steps, okay? Or instructions. There's 1, fasting and medications. It says, do not eat for 8 hours prior to your surgery. Do not drink water or clear liquids for 2 hours prior to your surgery. If you take medications, you can take them with a small sip of water 2 hours before your arrival time, unless you have been instructed otherwise.
So let me stop you there. I take a lot of medications, and I have not been instructed otherwise, which is, a little confusing for me because I do take estradiol valrate, and they do say you're supposed to stop taking your estrogen 2 weeks before surgery. Well, today is the official 2-week day before surgery. Am I supposed to take it this Friday or not? I don't know. It's a crapshoot. We'll find out.
That'll be a phone call.
Yeah. Well, yes. I mean, we're waiting on the hospital, so.
Yeah, that's true.
But what was the other thing you said? There was one other. What else did you say?
The clear liquids for 2 hours before surgery, and the no eating before 8 hours before surgery. And then no taking of NSAIDs, aspirin, blood thinners, or alcohol, or smoking for 2 weeks prior to surgery.
Right. Yes, and we cleared all that yesterday.
Yes, we did.
So those are, if I'm right, those are the preoperative steps that we have listed.
Well, there's more.
Oh, okay. Well, then let's continue.
I told you,
yes.
4 instructions.
Okay, well, let's continue, Aggie.
There's personal care.
Okay, personal care.
As the next category, shower or wash your hair the night before or the morning of surgery to minimize the risk of infection.
Okay, scoot in a bit. Let's talk about logistics with that. My locks are long and about 20 pounds when they're wet. Do you think I should shower the night before? Day before?
You're not going to wash your hair.
Well, no, I need to wash my hair. It says, wash your hair the night or day before to prevent infection. So I do have to wash it. Doesn't it say that?
I don't know. We need clarification.
Okay.
Because I'm not reading it as you have to wash your hair. It's, shower and or wash your hair the night before.
Shower.
The morning of surgery to minimize the risk of infection. But I mean, you don't have to wash your hair that frequently.
I don't,
but
but
I don't know. That's interesting.
yeah, we'll have to
That's an
get
interesting nuance.
Yeah, we'll have to get clarification on that. We,
Because
talking.
we're doing your hair this weekend.
We are doing my hair this weekend, and then the week before, yeah, we're gonna do that anyway. I was talking about just washing my hair, one day before, 2 days before, 3 days before, and just having a quick retwist. You remember, like if we,
No, we hadn't talked about that.
so I don't think we can get by with just one washing, between now and surgery. Oh, wait, between now and surgery? Yes, we can. Okay, never mind. We're good. We're good. We're good. We can do that. Puppies, get back. Um, let's go ahead. Let's
Okay.
go ahead. Woo!
There's no wearing of makeup, SPF or lotion on your face or body.
No body cream. No glitter.
Remove all jewelry
No jewelry. No septum rings.
and no acrylic nails.
I don't wear acrylics. I have got natural, beautiful nails.
So, next category is clothing and comfort.
I have comfortability.
Yeah. Wear loose, comfortable clothing such as stretchy shirt, zip down jacket, stretchy pants, and slide in shoes.
So I've got slides. I've got some red sweatpants that are loose. I don't know about the comfy shirt.
Well, we're still trying to sort that bit out.
Yeah, I mean, I kind of figure I have something. Maybe I can just put a robe on.
You got hoodies and like I said,
Well, the thing,
like I said, there's my big hoodie that you already tried on. It fits.
yeah,
It's a zip up.
yeah, that might be something that would work.
But anyway.
Yeah. Okay.
The last bit for pre-op is the scopolamine patch.
Scopolamine or scopolamine. Go ahead.
Which she will have to apply to her collarbone area the night before surgery.
And what's it for?
It is to help with nausea.
Yeah.
And it can be kept on for 2 to 3 days.
It's supposed to be kept on for that long, right?
Yeah. Well, so yeah, it says keep the patch on for 2 to 3 days.
Right. And so that'll be the night before surgery, the day of surgery, and the night after surgery. I believe they're also going to prescribe me Zofran, which is another anti-nausea medication. And I'll have to remind them about that because I don't think they've called it in yet.
Okay.
Okay. So
that's all the preoperative instructions.
That's all pre-op.
That's pretty simple. Everything else is very complicated.
That is pretty simple. Well, everything else is so the care instructions for everything else are
Postoperative care.
The postoperative care for everything else is similar. There are some nuances, of course, but a lot of it is similar. We'll try to cover some of the nuances. There's a lot here, so
yeah.
So the first is, what are we looking at this?
The preoperative instructions.
Right.
The first one is about the head wrap. So immediately following the surgery, there will be a head wrap that will basically surround the head here and through
the
here.
Crown. Yeah.
And that head wrap is supposed to be kept on for 48 hours after surgery. After the first 48 hours, you can remove the head wrap during the day, but must be reapplied at nighttime until the first week preoperative appointment.
So the head wrap, when they say the head wrap, do they mean the entire thing? Oh, so I can be just without
raw dogging it.
Okay. No gauze.
After the first 48 hours, you can, let that air flow and everything. And then at night, you have to wrap it back up.
Okay.
Next is the incision care. We have to clean the incision site, hairline, scalp, and under nose the night after surgery using a Q-tip or gauze and warm water.
So that's basically anything where they use sutures
or
staples, right? And
so basically we have to make sure that all those, especially around the sutures and staples, that it's free of any debris, any crusty crust of blood, or any serums that may be oozing, because it's normal for these incisions to ooze for the first 48 hours.
Yep. No pus. No pus, no
Yeah, we
muss.
don't want anything that's stanky or anything like that.
Right.
That
Right.
would be a phone call. But
Right.
but using just the warm water and a Q-tip and or gauze to help remove those little crusties. And then we are to apply bacitracin ointment to the sutured areas after cleaning to help prevent infection.
Right.
And it's supposed to be a thick, moist layer.
Yes.
And that's to be applied. And that can also be used to help remove some of the crusties too, like the stubborn.
How many times a day do we apply that? Did they say 3 to 5 or 2 to 3?
I think it's 3 times.
3 times a day. Okay. Okay.
This particular section doesn't specify, but there's more.
Right. Those will get into the details.
Yeah. But go ahead.
No, does this or have we gotten to, does this have a page 2?
Yeah, that's page 2.
Okay. Okay.
So more about incision care, no high pressure water during showers. Bathing may be easier during this time. So she's allowed to shower or bathe.
Bathing is going to be hard because our shower is
our bathtubs are teeny tiny.
Our bathtubs are teeny tiny, and honestly, I'm a big girl.
They're basically the
big person
sized for toddlers.
They're sized for toddlers, but I think it means that I can shower, just not having the water hit my face.
Yeah. Oh, that's another thing we need to add to the list of shower chair potentially.
Yes, shower chair. Definitely shower chair.
I wish I had.
Where's your phone?
It's right here.
Yeah, put it in your phone real quick.
Hold this.
Okay. So we're doing this on the fly, so excuse us as we notate things that we think of. We are now discussing the fact that we need a shower chair or a bath chair so that I can take breaks.
Well, and also to be able to angle the shower head in such a way where it's not angled towards her face,
right?
Only towards the torso area and below, so that way you can just use your arms to kind of move some things around. Sorry if I'm hitting my mic and making it obnoxious. Let me see. Thank you. Control freak.
Yes, you are.
You just wait till nurse egg shows.
Oh God. I'm happy and I'm like,
We're also going to be applying arnica gel to help reduce bruising and swelling, but that arnica gel can only be applied to areas like the cheeks, the chin, the forehead, not on the incisions themselves.
So not under the nose, not in the forehead incision, not on the incisions
around the front of the ears.
In the front of the ears, and you can tell them why not there.
Why?
Because I'm getting a facelift and a neck lift, bitches. That's why.
Well, okay.
I mean, but that's why.
Well, the reason why is because you're not supposed to put it on incisions, period.
Well, I understand that, but that's why there will be incisions there.
Yes.
And that has not been fully explained.
Okay. Understood.
Wow.
Next section is the cold and warm compresses. So for the first 3 to 4 days, we'll have to apply cold compresses, and then switch to warm compresses after that until the first week post-operative appointment.
Right.
So starting the 5th day, we go from cold to warm. And I think what we're going to end up doing is using the 4x4 gauze pads, and basically ice water bath.
Right.
And wringing out the moisture and then applying that for the first 15 to 20 minutes of each hour.
Right.
For those few days. Next up is nutrition. So make sure to drink protein shakes and soft foods for the first 2 weeks.
Yeah.
So she's allowed to graduate to to other foods, soft solids, as she feels comfortable doing so. Usually with that, after the first few days, you can start having like mashed potatoes, Jello, mac and cheese, things, soft things that aren't super chewy.
So I'm going to be having mashed potatoes all the time. All the time.
Be making mashed potatoes 24/7.
Yes, and I don't want the kind that are cold in the
Mashed
refrigerator.
taters.
I want mashed potatoes that are hot and yummy.
Do you want the rosemary kind?
No.
And rosemary
No.
garlic kind?
No. 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 Look at that.
Yes, I do.
Hey, Joe, how you doing? Thanks for showing up.
Next up, the other things that we were considering for nutrition, I know we're talking about like protein shakes, but also Ensures, Premier Protein,
Boost, anything like that.
right? No. And we're also talking about making smoothies,
yogurts, yeah.
So to help
Jello,
get some additional nutrition,
anything cool, to kind of calm me, because I will have incisions in my mouth.
Right. And that's for the buccal fat and the chin.
Yes, for both.
Yeah.
Yeah.
But those are the only ones going through the mouth. Everything else is on the outside.
Right.
The next section outside of outside of the cold compresses and everything and the nutrition, is the sleep position. So she has, for the first few days, she has to sleep in an elevated position, to help with reducing the swelling.
Yes. Yes.
So go ahead.
We have a wedge, and we have a lot of pillows, and we have, what's that U-shaped pillow? I guess it's
like a body pillow.
It's a body pillow. We have 2 of them.
Mm-hmm.
So we
can have the noodle.
The noodle. We can put one on either side. We can put pillows around me, and then the wedge behind me, and like a pillow on the wedge. So that way I'm kind of propped up and I feel comfortable. I feel like we're going to get a tray, or some way to get my phone, maybe my laptop, there plugged in. A bell or something, so I can get you.
She's really excited about this.
Might need a large bell, like boom.
We'll have to come in and be all like, you ready?
Yes.
Do you want to go over the medications?
Yes. Okay. Let me see if I can see these. So the first medication, now these are medications that I will have to take during the healing process. So afterwards, cephalexin, which is an antibiotic. I'm supposed to take it 3 times a day, and that's after a small meal, for breakfast, lunch, and dinner, to prevent infection. Take the first dose after surgery, following dinner. So my surgery is 12 to 14 hours. They did say that it could be pushed back a bit. So if it starts at 11, I don't know when I'm going to get dinner. Yeah,
I don't know, but
I'm not really sure how that's going to work.
I'm sure we'll figure this out once,
right?
As the time shifts, if it needs to.
Okay. So the second medication is Medrol, and if you know anything about Medrol, it is prednisone, and it is a zip pack. So, and what that means is that you start the first day taking 6. I think you take 6 pills.
The way that they have this
they have this differently.
Yeah, so the Medrol pack is like, it has a certain amount of pills you're supposed to take every day for 6 days.
There we go.
And it tapers down.
Right.
By the 6th day, you're only taking like 1 pill, right?
Right. So you may start with taking 4 or 6.
Right.
And then one day you take
gradually
2.
take less and less.
Right.
So you taper off of the steroid. But the way that they want to prescribe this Medrol pack for after surgery is you're supposed to take the first 2 tablets of day 1 after surgery following dinner. So with that cephalexin, right? But that just
go
talk
ahead,
about
go
the way
ahead,
they
go ahead.
and then you're supposed to resume the day 1 pills the next day.
Okay.
And then
Understood.
you follow each day like normal.
Right. Okay.
But that's the
So,
way that they have
well, once again, that's all kind of up in the air
based on
because
when your surgery is.
right. Right.
When's dinner.
Right. So the next medication they gave me is ibuprofen, 600 milligrams for pain and swelling. It says this helps to relieve pain and swelling. Take it every 6 hours as prescribed. You have a refill for additional doses if needed. So with the ibuprofen, we were told that I can also take acetaminophen to kind of offshoot and help get some pain relieving. Um, the next medication that we have on this list that has not actually been filled yet or prescribed, even though it will be, because we picked up pretty much every medication today, with the exception of this one on the list, which is hydrocodone. And so it's pain is needed. If you know anything about pain, you know about hydrocodone for the most part. It says take for severe pain in between or alongside your ibuprofen. I'm not sure of the milligram of the hydrocodone yet. It has not been called in, but I did talk to my surgeon's office, the front office, who are wonderful, by the way, and they did say that my surgeon was in surgery today, but that he would fill it tonight or sign off on it tonight or tomorrow. So
And maybe also the Zofran if we don't.
in the Zofran, yes. I will have to remind them again about the Zofran, I think. Yeah, because I've already reminded them twice. And they still didn't call it in.
Okay.
Yeah. No.
Well, then we'll get
Okay.
one way or the other.
So the next medication is the scopolamine. Scopolamine. Thank you. Scopolamine patch. That is the anti-nausea patch. I think we've already discussed it. It goes on the left collarbone as opposed to where it says behind the ear. We just do it on the left collarbone and it stays on for 3 days. The last thing we have on the list is chlorhexidine or chlorhexidine. It's a mouth rinse, a mouthwash.
To help
Basically
keep the mouth incisions clean after eating.
and the entire mouth, because infection, germs. So that is
those are all the major preoperative care instructions.
well,
The
yeah,
overarching one.
yeah, and some post-op, in terms of the medications.
Oh yeah.
So we do have 7 attachments. I'm going to kind of read them to you real quick. And one of them we've already done is facial no, we haven't done the facial feminization surgery one, but we have facial feminization surgery, buccal fat removal, hairline and brow lift, fat transfer, rhinoplasty, genioplasty, and lip lift. Alrighty, so Egg is going to get into the first one, which if you want to start the first one off, I don't know which way you want to go, but
I'm trying to go in the order that you listed.
okay, let's go into facial feminization.
So this one, most of these instructions are very, very much the same as what we've already kind of outlined. In general, like they have it organized in such a way where they have your activity in terms of limiting your activity over the first week following surgery. You're encouraged to walk around the house on the day of surgery and thereafter.
Why is that?
It helps to prevent blood clots from developing in the legs, which is very important. And especially for you, since you already have some issues with some edema in your legs infrequently, but right now that's controlled, thank goodness.
Right.
It says move and pump your legs frequently while lying down. This is also to prevent blood clots from developing.
Right.
When you rest or sleep, keep your head elevated with 2 to 3 pillows and avoid turning on your side. If you overexert yourself, bleeding or prolonged swelling may result. Keep your emotions under control.
Well, that is, so keeping your emotions under control is the hard part, understanding that there will be probably a dip in emotions at some point.
Yep, that's what it says here. It says it is not unusual to feel a bit depressed for a few days after surgery. This
Right.
quickly passes as you begin to look and feel better. Anger, crying, or other emotional outbursts will only add to the swelling or increase the likelihood of bleeding.
So,
Avoid.
Muffin, don't get me pissed off.
Wow. Avoid bending, lifting, pulling, pushing, straining, and aerobic activities for 3 weeks.
Okay, no movement, no partying,
No exercise.
no exercise.
You may begin to return to regular exercise 3 weeks after surgery.
3 weeks.
Easing into this gradually to the level back to normal by 5 to 6 weeks from surgery.
So that's a clip. That's like a month to a month and a half out, basically, without doing much of anything. I mean, and that's just to be safe.
Yeah.
After that, then I can rock and roll again, start exercising. Of course, I'm gonna have to learn better makeup so I can cover the bruises when I go outside, or or maybe I just wouldn't care and just look roughed up and people be calling cops on me and shit like that. So maybe I better learn makeup. Excuse me. Rude. Very rude. And especially
That
on a
was supposed to be
podcast.
my job.
That is supposed to be your job, but I took it. So okay, so let's continue, Aggie.
So bathing and showering, the same instructions as before. You can shower, up to the first day following surgery, making sure to shower gently and make sure you're avoiding direct water flow on the face.
So I have a question.
Yes.
The first day after after the surgery, when does that start? So I have the surgery, it's 12 to 14 hours. I'm in the hospital for the night, and then I'm released the next day when the surgeon comes by. If the surgeon doesn't come by until, let's say, 2 o'clock,
You're not leaving until 5,
so
probably, or
when does the
later.
day begin? When's the next day?
So it's a little muddled in terms of what they consider the day following surgery.
Right.
If it's the day you're in the hospital or if it's the day after you're released from the hospital.
Right.
The day, your first day home.
Right. I don't know.
Maybe.
We'll have to discuss
but
that.
we'll have to clarify that.
Yeah, that's another thing that we didn't get clarification on, but we didn't have that. So
there's instructions on how to deal with common side effects from surgery. A lot of this regards to bruising, swelling,
arnica,
which we talked about, the arnica gel, and of course doing the cold compresses those first few days.
And switching to warm the next few days, which I like to hear.
Yes, OnyxRose is not a fan of the cold compresses.
Not a fan.
But typically, if we see anything out of the ordinary, like excessive, like localized swelling or uneven swelling,
or blood
clots, or blood clots,
hematomas,
or if there's any pus or oozing that is foul in odor, then that's something we have to address immediately to avoid infection. Odor. Or avoid further infections.
Stinky.
It talks about medications, which we've talked about. Taking care of the incisions, keeping the dressings dry initially. Let's see here. Yeah, the incisions are the same for this particular section.
Yeah. Now, see, so that section is pretty much going to be the same.
The general, yeah.
Right. The main thing is going to be specific to
like
the actual part of the face and neck that's being worked on.
Mm-hmm.
So is that the buccal fat one?
Yeah, this is the buccal fat. Care instructions for buccal fat removal.
buccal fat,
It
and
says,
can you tell them where the buccal fat is, or should I don't really know. I'm not very good at it, but I think the buccal fat is like this part of your face right here, where it's kind of like chubbly and shit. They're gonna bring it, like, take go in the incisions and take some of that fat out. And my face is gonna then like go into a V more, as my chin also goes into a V.
right.
So it's nice and shaped, feminine like. So I think that's buccal fat.
Yeah. It says after buccal fat removal, you will have incisions in your mouth. Those are closed with absorbable sutures. Please do not touch or pull on the sutures, as they will spontaneously reabsorb 7 to 10 days after the procedure.
Wait, does that mean not touch with your tongue? Because like,
yeah, you shouldn't. You should just like not fidgeting with them. Well, so part of the reason why you don't want to do that is because you're stretching
oh, right,
your
right,
incisions around your
right,
mouth,
right.
and also inside your mouth. So you like just
That seems like it's going to be hard, you know?
it's going to be difficult. It's
Yeah,
going to be really challenging.
because I'm going to want to play with them.
Yep. Don't do it.
Well,
Um, use, let's see here, for your, oh, I think they have Paradex in here, but I think that's a chlorhexidine.
yeah.
For your dental and gum hygiene, and after each meal. Due to the swelling and trauma of surgery, the cheeks may feel a little tight after the procedure. However, this will improve rapidly with the use of ice packs or cold compresses. There may be some temporary numbness in the cheek area that may take up to 3 to 4 weeks to resolve.
So yeah, I'm gonna be a numb bitch, and I'm gonna have numb spots all over my face. That's the
Yep.
long and short of buccal fat. Aside from the general healing instructions or care for instructions, which are pretty much the same across the board. So I don't think we'll get too deep into those.
Yeah. Let's see here. This one is the fat transfer. Trying to see if there's anything.
So does
specific.
it say anything about the fat transfer? And like, I honestly, I think I found out yesterday that we were doing a fat transfer. Did we talk about that in pre-surgical consultations and stuff?
Um, I don't recall offhand if we talked specifically about fat transfer, but I mean, it makes sense. The fat that the buccal fat that they're removing, what they're going to do is transfer it here higher up into the cheekbone to kind of lift the
Right,
cheekbone,
right. Okay.
and give you that
That
lifted appearance on top of like the facelift and the neck lift.
right.
Give you
Nice.
those fleeky cheekies.
Nice, the fleeky cheekies.
Let's see here. But the fat transfer, it's really gonna be very similar. There may be like a single little suture that's right in that upper cheekbone area where they've
And
inserted
that'll
the transfer, but
that'll dissipate that, or is that
yeah,
something that I have to pull
I
out?
think those are reabsorbable.
That's
If
good.
I
They should
remember
make
right.
every mother thinking they should make everything reabsorbable, because those staples are scaring me. That's the one thing that scares me is the
Well,
staples.
those are gonna be up here.
No, I
and
understand, but
here.
them having to remove them.
Oh, I understand.
Oh,
Like I said, we're gonna get through it. We're gonna
well,
get through it.
well, here's to you, kid.
Let's see here. The brow lift and hairline advance. I'll see if there's anything specific that's
So, as
deviant
she's
from.
looking for the specifics, I'll just say the brow line and hairline advance. The hairline advance, they're just going to drop it down a couple centimeters. The brow line, they're going to go in here and smash these bones. No, the brow line and hairline. Is that the brow line? We're going to do these.
No, this is the hairline. This is
the hairline.
This is like the like the shortening of this.
Yeah, so they're going to bring it down. I don't know how much they're going to bring it down, but
I don't think it's going to be a ton.
It's not going to be a ton. No,
I think it's only going to be slightly.
Right.
Because like my forehead's like twice the size of yours.
I'm not going to agree with that on camera.
She knows I've got a 5 head. It's let's see. So in terms of the aftercare for this particular procedure, it's pretty much identical to the general instructions of making sure the incision is kept clear of any blood or debris, making sure we're using the bacitracin on there 3 times a day, and
thick layers.
Yep, nice thick gushy layers. And of course using that head wrap at night.
Right. Right.
For those first for that first week.
So let me ask, the head wrap for the first week is going to cover the staples, right? That's why they say that. It's to cover the staples, and I guess just to keep the face.
Well, it's
gravity.
It's just to help keep everything
Gravity, yeah,
together and secure, especially while sleeping,
and while the bones are healing and sealing back together.
Mm-hmm.
Yeah, fusing,
keeping everything secure.
Yeah, and my titanium plates, gangsta. Titanium. I will finally have titanium in me.
The bionic woman.
The bionic lady.
Next up is the rhinoplasty.
Rhinoplasty.
Let's see here.
And this is it's a special name for the rhinoplasty. One I've not really heard before. Like a is that it?
Yeah, I think it's septorhinoplasty.
Septorhinoplasty. That's pretty easy. Then I thought it was something else.
I thought that's what they said.
Yeah. Go ahead.
So a slightly different here is using a saline mist spray.
So that is for the nostrils.
That's what it has here. It says squirt saline mist spray and place a small dab of antibiotic ointment inside your nose 4 to 6 times a day, beginning on the first day of surgery. This will minimize nasal crusting. And make you feel more comfortable. Both the saline spray and antibiotic ointment are available at drugstores without a prescription. Yes.
So let me ask: does it say anywhere in there about them putting splints in my nose?
Let's see.
Because I could have sworn.
Yep. So
it does. Yeah.
So it says, there are incisions inside your nose, and in some instances, a small incision in the tissue between your nostrils.
The septum.
Yeah.
Okay.
All of your incisions inside your nose have been closed with dissolving sutures. External incision sutures are removed about 1 week after. The cartilage in your nose and often the bones have been carved apart, then reshaped and repositioned. There is no packing in your nose. You have delicate tape and possibly a molded plastic splint glued to the inside of your nose.
Which has been confirmed.
The purpose of the tape and splint is to hold your cartilage and bone in their new position while they heal together, to minimize the swelling that you will have and to protect your new nose.
I have a question.
Yeah.
I have a septum piercing. What does that mean for the cartilage in between the nostrils?
What do you mean? The piercing doesn't impact your cartilage.
Well, what's pierced?
The little fleshy bit right below
your little fleshy bit
cartilage.
A little fleshy bit of love.
Take that as a compliment. I think, what did we talk about? You're going to get your septum re-pierced.
Yes. So once I'm fully healed, I'll get my septum re-pierced. I might get a couple snake bites. Well, snake bites, you know what I'm saying? And maybe a nostril pierced, or both of them. Yeah.
Well, we will see.
We will see.
It says, do not rubber massage your nose.
Which I do a lot anyway, because my nose itches, and I also play with my septum ring trying to straighten it. People think I'm picking my nose, but I'm not. I'm straightening my septum ring.
Now, so it says that nasal stuffiness can be the most annoying problem that you can face after surgery.
Oh my God.
It's the most distressful in the first week after surgery and significantly improves once the internal nasal splints are removed.
So I don't like that word distressful
I
because
know.
that means like I'm not going to be able to breathe, basically.
You're going to be a mouth breather for a
Yeah.
while.
Wow.
Any residual stuffiness can be expected to gradually improve over a period of several weeks thereafter.
Several weeks.
Mhm.
Damn it.
Excess mucus is often present in the throat after surgery. This is due to splints inside the nose stimulating the nose to temporarily produce more mucus than is normal. This will subside once splints are removed 5 to 7 days after surgery, probably that first week
Yes.
post-op.
Post-op.
Numbness in the tip of the nose, upper front teeth, or roof of the mouth following surgery is to be expected because nasal surgery typically causes a temporary disruption of some of the nerves in the area.
So I'm going to have work on the tip of my nose.
Mm-hmm.
And so that's going to be numb.
Mm-hmm.
My teeth are going to be numb, which means like I'm not going to be able, the roof of my mouth is going to be numb, which means I have to be careful with warm food.
You got to be careful with eating and, small bites,
Yeah.
small swishes of your protein shakes and things like that.
Yes.
So it's just slow
going.
Right. Take your time.
Yeah.
The sensation in terms of the numbness sensation will generally return slowly over a period of several weeks.
Right.
Senses, some temporary decrease or alteration in the sense of smell or taste is typical after surgery. This is again secondary to disruption of some nerves in the nose during surgery. These changes will begin to improve within the first 1 to 2 weeks.
Okay.
But that's really the specific care instructions for the rhinoplasty.
Right. And like we said, all of these are going to be pretty general in terms of care instructions with some specific things added in for the actual procedure itself.
Mm-hmm.
Well,
all right. So the genioplasty, which is the chin procedure.
Which, by the way, let's everybody break. I have requested and will have to request again the bone that they're taking out of my chin. The little wedge of bone. I want that piece. So I am going to
the
push.
Hospital will let you have it.
Well, yes. Hopefully the hospital will let me have it.
So for this procedure, there will be an incision near where the implant was placed, either in a crease or inside the mouth at the gum line junction. The chin is taped to secure it in place after surgery while it heals. If sutures are used, they are removed 5 to 10 days. Sutures placed in the mouth will dissolve in a similar period of time.
Wait, is that what I'm having? Sutures in the mouth for genioplasty? Yes, I believe so too. Okay.
Bandages may or may not be applied to the wounds depending on whether or not they're needed.
Okay.
Let's see what it says in terms of care. It's the same in terms of swelling, using cold compress for the first few days and then switching to warm compresses. Exercise.
Yeah, no exercise is going to be standard. Elevated 3 to 4 weeks, potentially 5 to 6. That's the same for everything. Basically, I am going to be not doing much for about a month. Now I can do things like walk around and, go out, but like I'm not going to be able to lift much or do vigorous exercise, or anything like that for about a month. And that's fine. I'll just take it easy, take it breezy easy.
Next up is, and the final one is the lip lift. Let's see here.
Yes, I am getting a lip lift. I do have nice full lips. But the issue is the distance between the tip of my nose and the top of my lip. It's called the philtrum, and the distance, the length of the distance, is specific to people assigned male at birth, as opposed to people assigned female at birth, where it's shorter and the lip is lifted a little bit more to show more of the teeth. Okay, go ahead. The front teeth.
So a lot of this is very similar, but obviously the location of the incision itself is immediately underneath the nose.
So it will be visible. I will have a scar.
Mhm.
Yeah.
Hopefully, if we're able to make sure we're following the care instructions very carefully in terms of keeping the incision clear of debris and crust, and using the thick layer of bacitracin, um,
And staying out of the sun.
yep,
The
will help to minimize that scar as much as possible.
Right. And that is one thing that I don't think we've touched on enough. It's going to be very important that I stay out of the sun. If I'm in the sun, that I have a wide brim hat, that I can kind of keep all of my visible scars covered so that not because of vanity,
Mhm.
but because we don't want them to keloid or stay dark and visible.
Mhm.
We want them to like blend into my skin, or else I'll need to learn to use makeup like all the time. And that
Or
sucks.
even if it's just like little dabs of a little bit of concealer and
A
just
little
those
bit
little
of
spots, but
concealer, yeah.
that's not a huge deal. Like
Well, right, right.
so OnyxRose has like beautiful skin. I know she complains
I do
about
not have beautiful skin. Look at
she
this
she she
shit.
she okay. Will you hush for a moment?
Okay, go
Give me a
ahead.
compliment, please.
Go ahead.
So she complains about her dark circles, which I understand, but she has like the most like glowy, perfect little like skin. I know that she's tired of shaving and she's tired of dealing with the electrolysis and all the little things that she's had to do to help with keeping skin as clear as possible, both from hair and also from any kind of breakouts or anything like that. But when she just does like their like regular skin routine, super glowy. They get compliments all the time. Trust me.
Well, so I'm gonna own it. I do have I do have my skin can be good at times. It can also be bad in the sense that if I shave every day, I get these razor bumps and ingrown hairs. So I try not to shave, but maybe every 3 days. It's good right now because I am disabled. I mean, that's not the good part, but the part is that I'm not working. It's close to surgery. So I don't really have a reason to shave every day. If I did, that would be a problem too, and I just probably wouldn't be able to. I am going to pick up electrolysis once I am done with surgery, and I can afford to go back. Yeah.
Right.
Um,
Do you want to talk about some of the um, tools and things that we're going to be acquiring
yeah, let's do that.
for post-op care?
Go ahead. Yeah, let's go ahead and
So
roll down through some of them.
there's a whole host of things that we are getting or plan to get um, to help with the healing process. Obviously, we have to get the bacitracin, the saline wound spray, not necessarily to spray directly on, but to put on a piece of gauze and use, or Q-tips for the nose. And then we've got gauze pads, Q-tips. There's we could get the silicone tape for like beyond the first several days.
Yes, and I think
Um,
that's a really good idea. I really do.
there's also things like a humidifier.
Yeah, we're gonna get a humidifier tonight.
And then there's the uh bed tray that we plan to get that has like two different levels, so that way if she wants to use their laptop, it has like a little tilting section for her to be able to use that comfortably in the bed. um what else? I'm trying to think.
Yeah,
Oh, we need a new thermometer.
new
Our
thermometer.
current thermometer died.
Yeah, we
um
need to get some saline spray,
yeah,
some
forgot that.
gauze pads. a lot of gauze, a lot of saline spray,
Mhm.
because those things are going to be important. And,
We'll need
basic
more dial soap. We need
need some dial
gloves.
soaps, some gloves. We need to sterilize the space that I'm going to be in. You know, we'll need to get some. Now, this is where they do speak about
Shower chair. That was the other one.
a shower chair is one, but they do speak about dark curtains.
Ooh,
They
blackout
say
curtains. Yeah.
blackout curtains. We don't necessarily need to get blackout curtains, but we need something that will darken the room
Right.
significantly.
Right.
That
We've got some dark blankets that we can probably just pin up.
Yeah, that's what I was thinking. In the absence of buying blackout curtains,
Yeah.
we just use a dark sheet and then a dark towel,
Mhm.
because the room that I'm going to be in, light does not come in super bright, but it still
But it's
does come
still
in.
enough. Yeah.
Right, it needs to be dark.
Mhm.
Um, and so, yeah, those are the tips and tools and tricks that we've got going on until we hear from the hospital. So really, everything is riding on the hospital. I have a feeling that within the next week. So it's what, Tuesday?
Yes.
Tuesday. So Tuesday night. I have a feeling by next Tuesday I will have heard from them.
Mhm.
That is the hope anyway.
Right.
Because if it's any later than that, then that's when I start stressing, And as of right now, I'm calm and really in a good headspace for this. Y-
Yeah,
you know,
I'm feeling pretty good too.
well, I think talking with the old surgeon and the whole team yesterday really helped out a lot.
Well, having all of this information laid out
Right.
really helps because
Well, it
now we well, it
solidifies,
solidifies it, but it also gives like it now we have a framework. Now I can start building like this schedule in my mind of okay, so we know we have to take these medications this many times a day. We know we have to do the cleansing of the incisions this many times.
which means
What
we'll
all
have to
you know.
build breakfasts because this one right here does not eat breakfast, which a lot of times makes me not eat breakfast because I follow her lead.
I the first few days will be easy because you're just gonna be mostly liquid anyway,
But
so
I have to eat. It says I have to take the antibiotics, so I have to
well,
eat something.
I understand. We'll have the shakes or smoothies or whatever,
Right.
so you'll those will be easy to
But
manage.
let me ask you this: is a shake what they consider like something a breakfast to take an antibiotic with,
Yeah,
like an Ensure?
it's like a meal replacement, yeah.
Hey, we may have to talk to the doctor about that, like the surgical
Well,
team.
okay, if you wanna clarify, we
But
can, but
yeah, I think
that's
I'm gonna have to clarify that because, like, when I think of breakfast, I don't think of a shake. I just
but if
don't.
well, then what would be the alternative?
Like mashed potatoes
But you
or
can't
some.
have that the first couple days.
Why not?
That's you're supposed to be liquid first.
Oh, well, I don't know. It just doesn't seem like taking antibiotics on liquid stomach
Mhm.
means anything good except for puking, you
Well,
know?
I think, we know we need to stagger between the antibiotics and the any pain medication. We know we need to stagger those because we've had that experience before.
Well,
And then you weren't doing anything but liquid too. So
that is true. Okay. Well, I mean,
so
it
we know it's possible. It's just,
it is possible. So the day of surgery is the 11th, so it's rapidly approaching. Egg is going to, as we know of now, Egg is going to drive me to the hospital and we are going to chill until they take me back. And once they take me back, Egg is going to leave. I am asking her to leave. I don't want her to stay there. Um, I want her to leave because the 12 to 14-hour surgery, she does not need to stay in the hospital that long. So she's going to leave. She said she may take a walk at the river.
yeah.
Hopefully maybe Mish Mish can be available to hang with you or go over there and talk to her,
Right.
although it's going to be during her work day, so maybe not. Um, but something to get your mind off of what's going on, and what potentially could go wrong. Yeah. So That's it. That's what I really want for her. And also because we got a little one, not this little one. Where's the little one?
Come on, Squidgy, you gotta make your appearance.
Come on. Hi,
Hi.
Squidgy McSquidgems.
Squidgy.
This is Nyx, the notorious NYX.
PUG.
The notorious NYX. The notorious PUG. Yeah, so Nyx is our pandemic puppy, and he's our little baby. So that's one of the reasons I don't want Egg staying at the hospital, because she needs to come home and take care of Nyx. Nyx can stay by himself maybe 5-6 hours max, and then he needs a babysitter. He needs to go outside and use the bathroom. He needs some food.
He needs to lick some arms.
He needs to lick some arms, which he's doing very vigorously to me right now. See, you can see his little tongue. Blah, 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 blah. So, that day, and then of course, Egg will come back for an hour or two
the surgery has been
before the surgery's been over and I'm in recovery.
Mm-hmm.
And then she'll see me, I guess, when I get out of recovery.
I hope so. That's my hope. I'd like.
The problem with that is, that's going to be way up in the night.
Yeah.
And I don't want you to be that far from Nyx that way up in the night and having to drive home by yourself.
Right.
Yeah. So I'm thinking that we can just Nyx the whole night thing.
Well, so I think.
Oh, but you have to be there.
Yeah, I think I have to actually be there at least an hour before surgery is ended.
Right.
So that way I can talk to Dr. Wen post-op and what?
Go ahead. Go ahead. Go on. Yeah, talk post-op and
get any special instructions and also an update on how things went.
Yes.
So
now, wait, is this while I'm in recovery?
I would assume so.
Okay. And then you can go home because I'll be there in recovery and in the hospital for the rest of the night. She does not need to stay there for the rest of the night, but she's going to come back in the morning. Now, the thing about that is we're going to have Mish Mish, our bestie, to come over and let Nyx out or walk him. She's not used to walking dogs, but she's going to have to walk him, pee, and feed him. And so we're going to have to show her that whole routine,
right?
What that looks like, what his little spots are. And hopefully it won't be raining or anything crazy like that. And that way Egg can come back up to the hospital and hang out and then pick me up and take my bruised and FFS butt home, facial feminized surgery. And here's to hoping I look fleeky deaky, not for anybody else. This surgery is for myself, but of course, you also in the back of your mind hope that anyone that sees you says, that person is aesthetically pleasing. No. But I really do want it for myself. This is something I've looked into for a long time. So that it's coming to fruition is great. And I'm ready to go.
Manifesting positive results.
As always. Okay, Egg, it's 8:50. What time? 8:59. So I think are going to sign off.
Right.
What do you think?
I think so. I think
do you have any last thoughts? Any last things to say? We'll talk again before surgery, but do you have anything to say now? Not to put you on the spot. If you don't, that's cool.
No, I think I'm good right now. This was a lot of information. It's a lot of care. I'm definitely very, very settled and relaxed in terms of having this information. My brain needs it and craves it.
Yes,
so
it
that
does.
way we can start planning everything and figuring out what what we need to do in the next 2 weeks prior to surgery to get ourselves prepared, which is really important for both of us.
Planning is essential for both of us. We like a good plan. We like to be on top of things, make sure that we've got our P's and Q's, our little ducks, everything, dot the I's, cross the T's. We want everything in order. And we want everything in order beforehand. We don't want to be late for anything. We don't want to be rushing for anything, and that includes information. So right now, as far as the hospital goes, we're kind of, being held by the short hairs, but there's nothing we can do about that.
Right.
So
we are going to run with the information that we have and prepare the best we can. And that's all that can be expected right now.
That is all that can be expected.
And, as always, I am extremely proud of this wild woman next to me.
Thank you. Thank you. I'm proud to call you my partner and wife of 21 years together, 23. And we're going to sign off with that. This is OnyxRose of OnyxRose9.substack.com. The podcast is OnyxRose, a journey through FFS. And this is my wonderful wife and partner, Egg, of Eggy Salad on eggysalad.substack.com, which she does not use much, which is a shame. So y'all get up on there and riz her up. She is a writer. I have seen a lot of her writing and it is extremely good. She just won't put it out. I'm
a maker.
She is a maker too. She can write, she can make. The only thing she can't do is sing. And that's, at least that's a good thing. But she can do everything else. Okay. Joe, thanks for joining. Everybody else, have a great night. We're out. Peace and chicken grease.